Okay, I hope the connection's good. You are live. Hi, Eva. We are live on social media on Facebook, LinkedIn, and YouTube.
Hey, Michelle, good morning. Oh my gosh, I love being in spaces with you because you're just always so energetic and vibrant, and your energy just comes right off the screen.
Oh, thank you. Thank you so much. So, Eva, tell me a little bit about yourself before we get started so the audience can know who you are and what you do.
Well, my name's Eva Zobian Wolf. I'm a nurse. I've been in the medical care system for over 25 years now, uh, and multiple roles. My big chunk of my career was in the ICU as charge nurse
Hmm.
in a very hectic, uh, busy ICU where we worked in 2 to 3 units at a time. We all staffed 2 to 3 different units. And for me, I did not enter into the healthcare world with incredibly effective coping mechanisms. And so I ended up getting burned out. I didn't even realize I was burned out until I stepped away from the bedside um, to pursue working in yoga therapy. And it was the longer I was away from the bedside, the more I started to see all of the spaces where I was no longer myself and I was coming
Yeah.
back into that. And so now my work, it revolves around helping nurses to be able to have more energy, to have more um, improved relationships with their family and their friends, but really coming back into their who they really are, what makes them light up, what are their passions in their life, what are their purposes, and to be able to do that whether they want to stay at the bedside, whether they want to shift into a different portion of nursing, or whether they want to take that information, that knowledge and experience, and bring that into a whole other realm, like I did with yoga therapy. So, whatever that is, learning to be happy, healthy, confident, and be your most vibrant self
Yes.
all the time.
That's great, Eva. And how do we meet?
You and I were in a business coaching mentor program with Teresa Sanderson, the founder of Nurses Feed Their Young.
Yes.
You and I have both been in different spaces in the healthcare systems where it was the opposite. It was nurses eat their young. It was that
Exactly.
toxic mentality of I'm not going to let you have it easy because I haven't had it easy. So therefore, you should suffer as much as I have suffered,
Exactly.
which we know is absolute complete bullshit. That is not the way that nurses should
Nursing
be
is supposed to
nurturing each
be.
other.
Exactly. Exactly.
And somebody said once, and I thought this was such a fantastic way of representing it. And whoever said this, I forgive me for not remembering who it was that said this and not giving you credit for this. Um, in police departments, fire departments, the military, when people talk about their coworkers, they refer to it as a brotherhood, a sisterhood. And that is not the way that nurses collectively refer to each other. There is
Ex-
a us versus them, day shift versus night shift, ER versus ICU,
exactly.
hospital versus long term, right? There's
Yes.
this division that we create that is counterproductive to our mission and our purpose in life.
Exactly. And I'm kind of glad you said that because that kind of brings me into segue of what I started doing. If anybody doesn't know, I'm Michelle Carter. I've been a nurse for 25 years this year. And I've been working in long term care for 32 years. I started 32 years ago as a CNA and eventually just worked my way to become a director of nursing for the last 18 years. Not the same place 18 years, but in the role for 18 years. But I'm kind of glad what you said about that hospital versus long term care. long-term care has not been seen as a true healthcare entity from a lot of different nurses, and long-term care nurses have been looked down upon of, and especially our directors of nurses. And I'm here to help our directors of nurses to give them that support that they need, because it's more than being a director of nurse is more than just being in compliance. We need to nurture the whole person. Our directors of nurses, their mothers, their wives, their sisters, their aunts, brothers and uncles, because we have a lot of male nurses in a role also. And we're not nurturing the whole person. And we're not letting them know that they have the support that they need to be able, it's okay to vent. It's okay to ask questions and get support and learn from each other by you also helping yourself by self-care, learning emotional intelligence, and learning how to connect with individuals so you can retain your staff and you have better patient outcomes. And that brings us to what we're going to talk about today as our personality. Me and Eva are both certified coaches for the bank methodology, and we are bringing with other nurses that's in Nurses Feed Their Young and Thriving Nurse Network into healthcare to teach them about the bank personality and how personality science can change the narrative with your communication, with your connections, and reduce your frustration and your stress. Go ahead, Eva.
I was going to ask, so why is this important? How have you seen that using bank methodology give me some examples of how that has been effective for you?
Well, one, I could give you a great example. Me and my two ways, but the biggest one that was a game changer for me was my relationship with my administrator. Me and my administrator, I think it's just a very, very important. A director of nursing has to have a good relationship with their administrator, because at the end of the day, it falls on the two of them. And we were bumping heads constantly, but we were bumping heads because we didn't understand each other's personalities. And there was a situation that happened, and it just didn't turn out the way I would like it to be and how I reacted. And my reaction, if I would have known bank a little bit more at that time, my reaction would have been different, because I had to understand that it's her personality. It wasn't personal. She's a very high nurturer, and she needs to help everybody. And ideally, I want to help everybody, but sometimes I need to know what I need to do. I need to know the data. I need to know the root cause before I can make a conscious decision. And I'm a nurturer also, but my knowledge is a lot higher than my nurturer. And I needed to know that. But once we started, and I taught her a little bit about bank, and as I evolved about it, we're able to connect and understand each other's spaces and able to communicate better. And also, I was coming out of COVID, being in long-term care, because of course the world thought long-term care caused COVID, and dealing with everything that we dealt with. I was running in a crisis in a crisis era. And my action was extremely high. So I'm running around fast, fast paced, have to get everything done, and asking 25 questions to everybody. And it was like putting everybody off. And once I understood who I was, I had to do that self-awareness, tap into my emotional intelligence. I was able to communicate better with my team. I use it to build my team. I had a CNA who has a similar personality to me, and she was really, really driving the nurses. They didn't want to work with her because she had a lot up here to give and a lot of heart to give, and it was a little bit too much. Me and her I decoded her. We went through the personalities. I gave her some strategies, and she's had such a better relationship with the nurses, and more nurses are able to embrace her. So it definitely is something that is proven that you can help communicate and reduce that stress and reduce that burnout. But just imagine how this can help your patients and communicate with their families.
Well, and that's a big component, is that when you understand and we touch on this so much deeper in the masterclass, there's
Yes.
4 different codes, and each of the codes is a very specific personality component. And there's two personalities that are very similar to each other, and there's two personalities and then the opposite personalities, where it's like oil and water. And if
Mm-hmm.
you don't know that you're oil and the other person's water, and you're constantly having these butting head moments where everything, it's like you walk up to somebody and you say something with the best of intentions and a pure heart, and you're being kind and you're being compassionate, and they look at you and they are immediately angry and frustrated because,
Exactly.
and everything that they say is coming to you, and you're recognizing, okay, that's the opposite of what I just said. And it's
Mm-hmm.
not that that person dislikes you. It's not that that person is being intentionally obtuse or whatever it is. And that's the thing, is we create these stories of, why did this person not listening to me? And what we're not recognizing, one of the things that's challenging, is that how we relate to that person. If we're speaking, say I'm speaking Korean and that person speaks Italian, I can continue to speak Korean to that person all day long. But if they only speak Italian, what do they hear? It's like Charlie
Exactly.
Brown, womp, 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 womp.
Exactly. And just imagine as being a nurse on the floor and being a nurse leader, your trying to talk to your family members, trying to talk to your patients, or trying to get your team to buy in a new policy that we have, or to build your team up and putting them in the right position, or just the frontline staff talking to the residents, talking to the patients. Because a person comes into a healthcare setting, their personality doesn't change, and you're already under stress because you have 5 admissions, you had falls today, whatever may be going on, or you had a bunch of transfers if you're in a hospital, if you're in long-term care, you have different therapy appointments going out, you had a fall, a skin tear, so now you're already stressed, and here comes a patient who is stressed because they're in a different environment. You have a new nurse who is brand new, they're scared, and it just all comes out. But if you take the time to understand each individual's personality, and you know that the clues, and you understand what the personality is and what their values are, you'll know how to approach that person, and you'll know how to pull yourself out of it also.
And that's a big thing, is that this only takes less than 90 seconds.
Seconds.
But once you've been in this mode for a while, you start to hear keywords that help you say, oh, I bet that person is a blueprint. I bet that person is nurturing. I bet that person is a knowledge, right? And it's these little things that, as you start to get more aware, as soon as somebody says a specific word, structure, action, freedom, compassion, it gives you these clues, and you can start to shift the way that you speak so that they feel seen and heard. And right there is the absolute crux of this. How
Exactly.
people feel when you are having a conversation with them. If they feel that you are right here in the moment and you're listening to them, and you can say words that help them to know, I see you, I'm listening, I understand. And then be able to translate what they're saying so that what they say to you, you're taking it for how they mean it, right? Instead of saying, oh my gosh, I can't believe that this person is so frustrating. Why do they speak this way? Why do they focus on this particular thing? You can in turn ask questions and say, okay, that's great, but what I really need to know is this. Can you help me with this? And
Exactly.
saying in a way where they are able to go to look at you and think, oh, absolutely. And not think, I just put that person down. I just made them feel stupid. I just made them feel obsolete. When every time we're not trying to do those things, but that's
That's how
how
the
it's
person.
being heard.
Exactly. And we have to validate that person's feelings. We have to validate who they are. And that's where bank changes everything. Learning the bank. So, Eva, if a nurse is on here and they want to know a little bit about how to learn about bank, what do we have to offer them?
Well, the master class that we're going to have on June 26th, it's going to be 6 p.m. Central Time, 7 p.m. Eastern Time. It is a 1 hour class where we dive deeper into tips and techniques. But not only that, we're going to also show you how this makes your life easier, how
Easier.
you can be more effective and productive in your communication, but even more so, stop feeling stressed out around conversations, to feel more confident, to feel more empowered, to feel that your voice matters.
Exactly. Exactly. And again, Eva said our masterclass is June 26th at 6 p.m. Central, 7 p.m. Eastern time. But also after the masterclass, that's just the iceberg of just learning about bank. Me and Eva also often a 9 weeks coaching program that you'll be able to learn so much more. Bank has a wealth of education. It's not just taking your personality test and you're done. No, it's learning the ins and outs of the personality, learning the tips, how they dress, how they talk, how they move, how they live, the cars they drive, how you're able to formulate conversations so they can be heard, so you can speak that language. You may be speaking English every day, but you want to speak to somebody that's speaking Romanian. We're going to teach you that. We're going to teach you that how to speak that in their language. And that's through our 9 week coaching program. But
So
we
we
want,
have a
yeah,
support system
yes,
for you. But the master class is where we will give you some highlights and explain more.
exactly, exactly. Eva and I were both introduced to bank, and it has changed both of our lives, and helping nurses because we truly want to change the narrative for our nurses. We understand nurses are burnt out. We understand nurses are feeling the frustration and they're not being heard and their opinions are not being valued. And that's from maybe your management team, maybe from your family members, but also from each other. And this is something that can change the whole narrative. Nurses is one environment, one job that touches everybody's lives, no matter what. Because we're always going to take care of healthy and sick people, whether it's from helping with the birth of a child to holding a hand from the death of a parent. Nurses are going to be there to help, and we want to be able to save the nursing field by reduce that frustration, reduce that burnout, and bring nurses back to what they truly love, taking care of people.
So, if this is something that resonates with you, we would love to have a discussion with you about this. Show up on June 26th, and the link is going to be below this.
Yeah.
We'll be sharing the link, and we would love to see you at the masterclass. Share your frustrations and share your challenges and learn some tips and tricks, tips and tools, resources that you can use in order to be able to understand and to look at some of the conversations, some of the challenges that you've been facing at work and in life, and being able to look at that from a different lens and have a deeper understanding of where they were missing the mark on their end of the conversation and how you can approach that differently to feel more seen and feel more heard, and reduce some of the stress and burnout in different conversations that you've been having.
Yes, I'm excited that we have this opportunity to help our nurses. I'm excited to what bank can truly do in the healthcare system with us and Teresa and so many other nurses trying to bring this in. I'm just excited because we know how it's helped us as individuals, how it's helped our team, the Codebreaker family. So we want to make sure our nurses get this education and this knowledge to change the narrative for them. Eva,
Absolutely.
I love
Absolutely.
that we had this time to just, take a couple 15, 20 minutes to let the world know what we have in store. I love working with you, and I'm so glad that we had this time to talk to everybody. Do you have any closing remarks before we end out today?
Always lead with kindness, compassion, and without judgment. And when we do that, we're coming from the place that originally is what brought us into our nursing profession. And that is one of the best ways that we can take care of ourselves and each other.
Thank you so much. So, thank you everyone for watching us, and we will see you at our masterclass, Reduce Frustration. Reduce Frustration is June 26th, 6 p.m. Central, 7 p.m. Eastern Time. And I'll see you in a couple weeks. Have a great Saturday.
Thanks, you too. Take care.
Bye.